Welcome back to another edit video. Don't forget to like and subscribe. Hospital surgeons, what was your oh crap moment? Doing a C-section for this poor mum who'd been in labor for hours. Baby wouldn't come out of the hole we'd made, so more pressure was applied to the fundus, top of the uterus, and suddenly whoosh, baby zooms out like a torpedo, covered in lubricating vernix, zips over the surgical sheeting which has the texture of a slip and slide and almost rockets straight off the table. The baby's foot was caught by the reg who whipped her up in the air upside down like in old cartoons, but almost dropped her again due to gloves plus vernix. Thankfully the midwife was ready with a towel and caught the baby to wrap her up. Mum and dad seemed to think this was normal practice and didn't notice, but me and my colleague just stared at each other with a look of absolute horror. It still makes me shudder to think how close the baby was to hitting the floor head first. Never happened before or since. I was doing a corneal transplant when I had the oh crap moment. During surgery, I cut off the patient's own cornea and replace it with a new donor cornea. During that moment, when the host cornea was off, but before I could get the new one on, there's literally nothing on the front of the eye except a tear film and aqueous humor. Anyway, the patient takes that moment to start vomiting. The reason we tell everyone to skip food and drink is so they don't aspirate in case they throw up. This patient lied about eating breakfast and started throwing up everything. The eye is still open sky at this time. Everything inside of the eye can now become outside of the eye, and she's bucking and vomiting. Those not in the know will say this is not good. Those really in the know will say oh crap. Anyway, I had to grab the new cornea and start stitching as fast as I could on a patient actively throwing up. I used 10-0 nylon sutures which are thinner than an eyelash. It turned out okay but not great. Don't lie about eating breakfast before surgery, folks. Happened at my hospital. A mentally ill young woman who was pregnant at the time was in denial, locked herself into her room when she realized the contractions were coming. She basically didn't push and the baby didn't come naturally. Her family called 911 because of the smell. The ER realized her baby had died inside her and was basically rotting due to the smell. She was taken to the OR to remove the baby and apparently all the nurses and surgeons were vomiting because once they opened her up the smell was overpowering and it was traumatizing to see a rotting baby. Not a surgeon. Thought I'd share this though. Husband went in for a routine colonoscopy and as they were prepping him, anesthetist asks him if he's a ginger. My husband tells him yeah. When he was a kid growing up, he had fire engine red hair, though it's faded to a more strawberry blonde now. The anesthetist laughs and says, okay, I gotcha, we'll give you the redhead dosage, and winks. Well, my husband thinks it's a funny until he wakes up at the tail end of the procedure, pun intended, and doctors are just chatting it up and what have you. Turns out it's not a joke and redheads have some type of natural block to anesthesia. Dude had given him maximum allowable dosage and he still woke up. Happened a couple years later. They gave him ketamine and some other shit to knock him out, to get wisdom teeth out. When he told dentist about the colonoscopy thing, he still woke up at the end of that one too. Surgeon here. I've dealt with loads of morbid stuff, but one thing that made me stop and go oh crap was a conversation with a young patient who had a perforated colon from diverticular disease, which is a common wear and tear of the colon. He was one of youngest patients I had seen with this condition and certainly the youngest with a perforation so bad as to require an operation. When I was counseling him on the operation, which involves removing the perforated part of the colon and giving him a colostomy, he told me his biggest concern was how he was going to have anal sex with his same-sex partner. He would only have a small stump of rectum left inside, which would be at risk of perforation with any force applied to it. It made me really think about the implications of the surgery we do. The operation is the easy part. When I was a new RN working the ICU in a large teaching hospital, I came into work one morning to a patient that was admitted that night, intubated, breathing tube in, sedated, Farley catheter, tube and PP hole, and all. Long story short, he was extubated, breathing tube out, that same shift, and was completely alert and oriented. He was an end-stage renal patient, meaning his kidneys didn't work and he needed dialysis, and was only in his late 30s. Said he never made urine anymore and didn't need the Farley catheter, so he wanted it out because it was hurting. Now the catheter bag had been empty my whole shift, which is normal seeing as how he didn't make urine anymore, and this hospital had a nurse-driven Farley removal policy, meaning while we needed a doctor's order to insert one, we could remove one at our discretion, unless a doctor specifically put in orders not to. This patient had no such doctor order, so I went to remove the catheter. They are held in the bladder by a balloon on the end that is inflated with 10 milliliters of saline. I de-inflated the balloon, removing 10 milliliters of saline, and pulled it out. As soon as the catheter left his penis, blood started pouring out in a heavy stream. Turns out the nurse who placed it on admission hadn't advanced it far enough, since there was no urine production to indicate correct placement, and had inflated the balloon while still in his urethra, causing trauma. It would not stop bleeding. I had to hold this man's penis shut to put pressure on it, while my co-worker Paige, the resident who came and looked at me with pity as he told me to just keep holding this 30-something-year-old man's penis in my hands to staunch the blood flow until urology could get there to assess. It just kept gushing blood every time I eased up to check. For over an hour total I held this man's penis and tried to make polite conversation until the urologist arrived. Not a surgeon, but was working in obstetric theatre in UK at last year. This is important as maternity wards are kept quite warm as newborn babies aren't good at regulating their temperatures. Combine this with a heat wave and the fact that in Britain we are not exactly used to high temperatures, and we have the perfect storm. Mid-emergency Cassery and the scrub nurse assisting the op starts feeling faint. This is unusual as this scrub nurse worked in these theatres full time, so this was her bread and butter, so I can only conclude it was the heat. She has to step out, so the show takes her place assisting the obs registrar with the section. This show looked extremely junior, as in first section ever, and they were trying to assist with the instruments in the uterus when they fainted. I had to jump in and grab the back of their theatre gown to stop them faceplanting the open uterus, and then sort of gently tug backwards to let them fall into me when someone else has taken over assisting. This show was not exactly small. Thank God the baby was already out. 5th year resident here. There are lots of bad oh shit moments throughout training, such necrotizing soft tissue infections or takebacks for bad complications or deaths during cases. However, I'd like to share a recent positive oh shit moment. 15 cm kidney tumor with thrombus into the vena cava. Big incision, great exposure of the vasculature in the tumor. My attending and I are dancing around the aorta and vena cava. We are able to feel the tumor thrombus in the IVC. I was expecting that we'd need to cut and clamp the vena cava to get all the cancer out, but my attending literally squeezes the tumor out of the vena cava back into the renal vein and then has me tie the renal vein off so the tumor doesn't slip back into the vena cava. Patient went home in like 4 days, margins were negative, and is still doing great. First time I felt like oh crap, I'm a surgeon. Had an oh crap moment as a patient on the operating table. A couple of years ago I was in labor for 28 hours, pushing for 6, when my child started showing signs of distress. He had slightly elevated heart rate, and I had the makings of a fever. My midwife at the hospital told me the doctor was coming in to check to see if a vacuum assist could help. She checks me and immediately stands up with blood on her hand and says we are going to the OR now. At that time, I started feeling that zoomed out tunnel vision I know for me is shock. I had anxiety, but figured she knew what was best. She did. We got in the OR 8 minutes later, and when they opened me up, I heard the surgeon say, "Oh crap, look at this." They say blood in my catheter bag, and upon fully opening me up found my son was actually trying to come through my uterus. He had ruptured it. They got my son out. Those moments where he was stunned and not crying were an eternity. He cried and he was born a completely healthy baby. After I woke up and was back in my room, the doctor came in and told me what happened. I knew a ruptured uterus sounded bad, but oh damn, I googled and started having a massive anxiety attack. A ruptured uterus is extremely rare and so very dangerous and often fatal. I read from the time it happens you have about 15 minutes before you bleed out and baby is dead. When I went back for my post C-section follow-up, my midwife let me know as a practice that's been around 35 years with over 30 midwives and doctors, they had never once encountered that, and it was such a big deal for them. A few days after my birth they all got together to discuss my case. I was so incredibly fortunate I chose to labor in hospital that the doctor just knew from my vitals and babies that something was off. They just didn't know until they got me open. I can't even tell you how grateful I'm for Dr. S. You saved my life and my son's life, and our family will forever be grateful. Sorry in advance for this being so long. Not a surgeon, but my mom had to have a kidney removed due to her waiting for almost 2 years to go to the doctor about her pain in her back. The doctors found out it was a large kidney stone and that her kidney was infected and had lots of gross pus shutting it down. After draining the fluids through tubes over the course of a month and a half, she was finally ready for surgery. Cue last Wednesday, the day of the surgery. She was ready to finally be done with it. They removed the stent put in, and the tubes no problem. Next was the kidney. Here comes the oh crap moment. As they get ready to remove the kidney, there was complications. The kidney's infection had spread to a portion of her lung and a major artery, making them fragile as toilet paper. As the surgeon removed the kidney, a hole was torn in the lung, and even worse, the artery was severed. At that point it was a race to save her life and stabilize her. I don't remember much about how they fixed her up there, but they had to fly her to a different hospital and have a heart surgeon fix the severed artery in a more permanent fashion. Anyways, the heart doctor saw the grave situation and said she's got a 1% chance for her to make it. But he did such an excellent job that my mom is still alive and getting stronger each day. The moral of this story is, if you have insurance and are experiencing pain, go to a doctor as soon as you realize it. You may save your life and also save some doctors from an oh crap moment like this. Former medical student here. Rotating through general surgery was mainly an enjoyable time. I remember one young patient, 22 years old, was revisiting the ER, where he'd been seen 6 weeks prior for sustaining some abrasions and bruises after falling hard off a skateboard. He was all scraped up everywhere but had healed up okay. But now he's in the ER again, feeling awful sick, vomiting and with a fever. As the third year med student I was dispatched to the bedside and hung up the CT films on the light box. Too much finger pointing and grunting among the surgeons. I had no idea how to read a CT at the time, wasn't even really sure what part of the body had been scanned. So when the surgical resident barked prep him for surgery, I was nonplussed, decided to disguise my ignorance and just go for it, as was the approved way for students at this busy public hospital way back when. We got him gassed and prepped and I scrubbed in. Surgeon said open, and I raised the number 15 blade. He'd been prepped for a midline laparotomy, but I guess I exposed my ignorance when I spoke up to confirm same. This was decades before timeouts, before on-site became an ever event, because everyone laughed. I opened and it went uneventfully, reflected the Amentum with its lovely arcades, and exposed the viscera. You remember how to perform the Kocher maneuver? The attending barked. Yes sir. Well do it. I slid my gloved hand up into the splenic flexure, getting well ready to grab the entire sack of intestines and move it up and over the opening salvo of the Kocher maneuver, but met unexpected resistance. I peered up, seeing in my confusion that everyone was edging away from the table. What's the trouble, young man? Get your hand up there and complete the maneuver. Push harder. A spongy sort of barrier gave way, and with a sickening stench, immediately recognizable as the locker room aroma of Staphylococcus aureus, a gushing cascade of 2 liters of grey-brown, bloody pus roared out of the incision, soaking my gown, scrub pants and shoes, before splattering on the OR floor and walls. The splenic abscess, doubtless caused by the transient bacteremia from his skateboard accident, had been list, ruptured, evacuated and mostly cured. The attending finished up with the splenectomy, and after some abdominal lavage the patient was good as new. I had to throw out my shoes. As the patient, I hope if the oral surgeon is on Reddit they posted this story. Wisdom teeth removal, all 4 impacted, gotta break out the heavy hardware. I'm knocked out, don't even know the dentist entered the room. I wake up, but not able to move, just eyes open awake, but my limbs won't react to my brain. I can feel the dentist hammering a chisel into my tooth to break it for extraction. My jaw is just coming undone on every hit. My eyes are wide open, jaw even wider with some evil metal contraption. I'm staring at the assistant begging for her to see me, and after about a dozen hammers to my jaw she glances over and drops the suction, jumps up and shrieks. The dentist stops to look at her, then looks at me, and I see him say oh crap. Next thing I know I'm waking up post-surgery. Crap that nightmares are made of. Like and subscribe for more Reddit videos.